Good afternoon. This is Gary Herbst, the Chief Executive Officer at Quia Health, coming live to you from the Quia Health studio here. I'm joined by Maria and Daniel, the production crew in the background, but I'm incredibly disappointed, and I know you will be even more disappointed that I have to inform you that Deb Velosin is on vacation today. So my lovely assistant, which is probably the reason you normally tune in every 2 weeks, is to hear Deborah, because she's always fun and makes this fun. But unfortunately, all you have today is me. So I'll try to make it as entertaining as possible. My job is mostly on the informative side, and it's been Deborah that was the entertaining side. But we'll welcome her back here in a couple weeks. So I'm actually going to read the questions that she would normally be reading, and I actually have no idea which number this is in terms of the times we've conducted this. She always starts out with, this is our 55th or 60th community huddle, but gosh, I don't have that number. So that'll be one of the numbers I don't have. So let me start off just giving you kind of an overview of where we are today at Quia Health relative to COVID. So as of an hour ago, we have 118 COVID positive patients that are currently in the acute medical center. They're all adults. We've had 1 or 2 children over the last couple months when the Delta pandemic really kind of broke out in August, but no children today. Unfortunately, that number of 118 appears to be pretty steady. The height of this fourth surge that started back in August, I think the most we ever had was about 130 COVID positive inpatients. So it's dropped down a little, but not as far as we'd like it to. In terms of the number of COVID positive patients that are in the ICU and just the condition of our ICU, we currently have, of those 118 COVID patients, and I forgot to mention, we actually have another 4 COVID positive patients that are in the emergency department that need to be admitted, but there isn't a bed yet open for them. So they're being cared for on an inpatient basis in the emergency department. So technically, I guess we have 122 COVID patients today. 18 of those COVID patients are currently in the ICU, and I believe that all of them are on a ventilator right now. In fact, we have 19 COVID patients that are on ventilators. So we do also put COVID patients in the intermediate critical care unit, and we are capable of intubating patients in the ICCU. As of 7:03 this morning, which is the time that the daily email comes out, I don't know why it's at 7:03 and not 7 o'clock, but every day we get an email of what the inpatient census is as of that point in time. And at that time, the 21-bed medical ICU located on the second floor of our west expansion was completely full. There was not a single ICU bed available on that unit. And then in the Asequia wing, the most northeastern part of the acute medical center, we have a 20-bed cardiac ICU, although right now we're using it for non-cardiac patients as well because of the medical ICU being full pretty much every day. So we only had 2 of those 20 beds that were available. So 41 total critical care beds, intensive care beds across the medical center, and only 2 of those beds were open for new admissions. In terms of our employees here at Quia Health, since the beginning of the pandemic, we've had 1,545 of our employees and 39 of our providers. So those are physicians, physician assistants, and nurse practitioners have contracted COVID since back in March of 2020. As of today, we have 53 of our employees that are out on a COVID leave of absence because they have tested positive for COVID. We don't currently have any of our providers that are out on a COVID leave, so that's wonderful to hear. Of the 53 employees that are out on leave, 10 of them have been out on leave since last year, since 2020. And I don't know if it's that they haven't fully recovered or they're still having lingering residual effects of COVID, or they've simply made a decision that they're not ready to come back to work. But they're still part of our QUIA family, they're our employees, but they're just out on essentially an extended leave of absence. We also have another 18 employees that don't have COVID, but they're quarantined at home because they live with somebody that is positive for COVID. So all in all, we have 71 of our employees that their presence here has been impacted by COVID. Over the course of the entire pandemic, sadly, we have lost 4 of our employees and 1 of our providers to a COVID-related death. And we currently have 1 of our employees that is on a leave of absence that is hospitalized at this time. So definitely our thoughts and prayers are with that employee and their family. In terms of the overall hospital census, again, as of 7:03 this morning, 333 of our 344 adult acute inpatient beds were occupied, including the 12-bed pediatric unit that we essentially have turned into an adult overflow unit. So we now count that pediatric unit as an adult unit. So that's part of the 344 total capacity. And I think 11 of those 12 beds were occupied this morning. So that translates into an overall occupancy rate of 97%. But at the same time, we also have another 39 patients that are in the emergency department, in the waiting room, or they're in an exam room, and a determination has already been made to admit them. So in fact, they have been admitted. And the adult hospitalists and the nurses from upstairs actually come down to take care of them. So to provide medications and diagnoses and treatments. Unfortunately, we're providing literally inpatient care in the emergency department because we don't have beds available upstairs. Now, eventually those 39 patients will make it upstairs, and usually it's within a day or 2, depending on how quickly we can discharge patients from upstairs. But if you combine those that are already in inpatient beds and then those that are admitted, we call them admit holds, down in the ED, together we're essentially operating at 108% of capacity right now. Definitely the Central Valley, Fresno, and Tulare County, Kings County, we continue to have some of the highest COVID hospitalization rates and the highest overall occupancy rates really of any place in the state. We talked to a hospital down in LA who only has 24 COVID patients, and it's a hospital bigger than ours. But they have a much higher vaccination rate in those other communities. So definitely there's a strong correlation between vaccination rates and COVID hospitalized patients. You look at the Bay Area where their vaccination rates are almost 80%, they have a handful of COVID patients. Here, we haven't yet hit 50% in Tulare County, same with Fresno County, and as such, we have some of the highest number of COVID hospitalized patients. I am very pleased to report, and I really commend our employees. You know, back in July, I think it was, that Governor Newsom issued the first in the country vaccination mandate, that all hospital workers, all healthcare workers for the most part, up and down the state, had to be vaccinated by October 1st, or unless they were approved for an accommodation, an exemption for medical purposes or sincere religious beliefs. So as of today, approximately 80% of our those employees that work for Kauai Health that are actually subject to the executive order. 'Cause there is a few hundred employees that never have any patient contact, never pass through any area in the organization where healthcare is provided. So under the governor's order, they are not required to be vaccinated. Many of them are, just by their own personal decision, but they're not mandated. So with respect to those that are mandated under the order, that's where 80% of our workforce is vaccinated. And kudos to the medical staff, they're at a vaccination rate of 98%, so just outstanding. So that's kind of the current COVID condition and just the overall demand that we're experiencing here at the Downtown Medical Center. Can you give us an update on Kauai's staffing? Well, it's not good, but we're making it work. We currently have close to 700 open positions across the entire organization, and really every single department. So not just nursing or clinical care, it's literally registration staff and case managers and housekeepers, dietary workers. I mean, literally every facet of our operations has been impacted by a shortage of staff. 700 is definitely the highest that we've ever experienced. We have 5,100 employees, so to have 700 of those positions vacant, we feel that in a very impactful way. The way we're making it work, though, particularly in the critical clinical areas, so RNs and LVNs and CNAs and respiratory therapists and all those folks that are on the front line taking care of patients directly, we are encouraging them, rewarding them financially for working overtime, working extra shifts. So if a registered nurse who normally works 3 12-hour shifts in a week, if that nurse will work a fourth shift, 12-hour shift, we will pay them time and a half for those 12 hours and provide a $1,200 bonus. If they work a fifth shift, we'll pay that shift at time and a half and pay them a $1,500 bonus. We are spending more than $2 million every pay period. Every pay period's 2 weeks. So for the last 2 pay periods, the one ended on September 18th and October 2nd, between overtime and these extra shift incentives, it's more than $2 million in extra reimbursement. And we're receiving no funding to help cover that. So nothing coming at this time from the federal or state government. So in essence, we are deficit spending. Through the first 3 months of this fiscal year, July, August, and September, we're about $8 million under budget. We actually had a positive month in July, but we lost $4.5 million in August and then just posted a $2 million loss for September. And really all of it is being driven by just that incredibly high premium compensation that we're paying. And we're gladly paying it. Bless our nurses and all our clinical workers for their willingness to keep at it, just keep slogging along. It's been very tough for them. They are an incredibly dedicated, selfless group of people, and I just think the absolute world of them, and no amount of money can really express our appreciation and gratitude. The thing we worry about is it's going to come to a point where no amount of money is going to be able to help them work through that exhaustion. So this is really unsustainable. We need this virus to go away or to become more normal. We have more than 100 contracted traveler nurses that are here, and thank goodness for them. They're helping support our employed staff, and again, I can't imagine what we would do without them. But they are becoming increasingly scarce because many hospitals across the country are similarly having to rely on travel nurses to fill their gaps. So there was a question about some parents did a protest of mandated vaccines and mandated masks for school children. You've heard the governor has indicated that he is going to mandate vaccinations for children age 5 years and up. Most likely in January. He's going to wait till the FDA has approved one of the vaccines for children. That testing, that study is going on right now, but he's indicated that he will mandate it. So in protest of that mandate, a lot of parents kept their children from attending school in person this last Monday. I don't know how extensive that was here in Visalia or in our community. I mean, we certainly saw it up and down the state. And the question was, did Kauai feel the impact of that? So did a lot of employees stay home or call in sick to be there to, watch their children while they were not in school? And I really don't think so. I spoke to some of our nurse leaders. I can't speak for all positions across the organization, but with respect to bedside nurses, we only had 8 nurses that called in sick for Monday's day shift, which is actually a very low number. Last night, for the night shift, we had 15 nurses that had called in sick. So I don't think it really had any impact here at Kauai. Have you heard any more about the COVID-19 pill that is getting ready to be approved for emergency use? So the giant pharmaceutical company Merck and then a biotherapeutics company by the name of Ridgeback has produced a COVID-fighting oral antiviral medication by the name of Molnupiravir. I think I got that right. Their published clinical study, and they conducted a study of only unvaccinated people that had tested positive for COVID, and they gave them this oral antiviral medication, generally within 5 days of the onset of symptoms, and then they gave a placebo to the other half of their study group. And they found that within the study group that received the oral antiviral medication, that there was a 50% reduction in hospitalizations and severe COVID. So they were very, very excited about that. It surpassed what they felt, was their targeted efficacy. And as a result, they essentially informed the FDA that they were going to stop any further study and would soon be applying for emergency use authorization from the FDA. The FDA indicated that they will likely have their advisory committee start beating up the data at the end of November, and if it's approved, that likely will occur in December. So we don't know when in December. In terms of who will be eligible to receive that pill, I think it will be a lot like the antiviral, the monoclonal antibodies that Regeneron has been using, although theirs is an IV therapeutic, antiviral therapeutic, and that one can be given all the way up to 10 days from the onset of symptoms. Although the sooner you get that monoclonal antibody, or it appears that this antiviral medication from Merck, the more effective it will be. Still probably uncertain exactly who will be eligible to receive the antiviral pill, but it looks like that you'll have to have at least one of the factors that put you at higher risk of severe COVID or hospitalization. And these include obesity, diabetes, heart disease, or being over age 60. Participants, again, I mentioned in the trial, they were all unvaccinated, and they all got their medication within 5 days of developing symptoms. So it's also likely that that will be an eligibility factor, that if you're vaccinated, you won't be eligible to receive this antiviral pill, or if you're more than 5 days out from the onset of symptoms, you most likely won't be eligible as well. Next question, when a patient is put on a ventilator in the ICU, what are their odds of coming off of it? In the beginning of the pandemic, being put on a ventilator was considered a death sentence. Is that still the case? So in calendar year 2020, our mortality rate for COVID patients that were required to be intubated and be on a ventilator was 71.2%. So that means the survival rate, where they overcame COVID, they were extubated and eventually discharged home, was just under 30%. And you may have heard me talk about that 30% in a past telecast. So for calendar year 2021, so from January 1, 2021 to September 30th, so over these 9 months, that mortality rate has dropped slightly. So it's come down from 71.2% in 2020 to 68.5% in 2021. So the survival rate has ticked up slightly from 29.8% to 31.5%. The next question, is it safe to mix vaccine doses? In other words, getting a Pfizer booster for those who previously received the Moderna vaccine. It is being reported that your immunity might be higher if you mix vaccines, especially for those who received the Johnson & Johnson vaccine. Well, hot off the press, last night the FDA approved allowing Americans to receive a different COVID-19 vaccine from the one that they previously received. They also approved a booster shot for Moderna and Johnson & Johnson. So they did that all at the same time. So all of us that have been vaccinated at Quia Health, for the most part, we all received the 2-shot Pfizer vaccine. So we now could receive another Pfizer dose. You have to be at least 6 months out from the date of your second dose. But we could receive Pfizer, we could receive Moderna, or we could receive Johnson & Johnson. So same for those that received the Moderna vaccine, which was also a 2-shot regimen, or received the Johnson & Johnson vaccine, which is a 1-shot vaccination. They can receive the Pfizer vaccine or Moderna. Essentially, you can now mix and match whatever works. And I think that the FDA generally has been encouraging people to still stay with the same vaccine for your booster shot for that 3rd dose. I don't know if it will make much of a difference if you had Pfizer as your original vaccination and then you have another mRNA booster shot in Moderna. They're both manufactured the same. They both had very similar efficacy rates. I think where you really, and this is what a lot of the data shows, is that those that got the single shot of Johnson & Johnson but then got a Moderna booster shot or a Pfizer booster shot, that they saw a significant increase in the presence of their antibodies rather than getting just another Johnson & Johnson. And if you get the Johnson & Johnson vaccine, let's say you got it the first time, you got that single dose, then the second dose will be a half a dose. So they've found, by their study, they believe a half dose with a booster shot is sufficient. And you can get that, you can't get that booster until you're at least 2 months out from when you got your original Johnson & Johnson vaccine. And with respect to the Moderna vaccine, just like the Pfizer, you have to be at least 6 months out from your second shot. So that's great news. I mean, that absolutely gives us a lot more flexibility. It also gives us a lot more potential supply. I think it will make it a lot easier. And there are a lot of folks that, frankly, have forgotten which version of the vaccine they got. So now really it won't make a difference. You don't have to have that memorized. So this was really good news. Oh, so also on the topic of vaccination, I want to invite any and all of you that if you're interested, this coming Saturday, October 22nd, in Tulare at our Tulare Health Clinic, located right by the corner of Mooney and Prosperity on the southeast corner next to the gas station. That's where our Tulare Clinic is located. And from 10 in the morning till 2 in the afternoon, we'll be conducting a vaccination clinic. And we will have silver gold medalist Richard Kiki Torres Jr. Will be there to help us punch out COVID. So he'll be signing autographs. We'll have light refreshments there. And you also have a chance to win one of 6 boxing gloves that will be autographed by Kiki. You don't have to be vaccinated. It's not a condition of participating in the opportunity drawing. But we're certainly, those that are yet to be vaccinated, this is a great opportunity for you to really think about getting that vaccination. I will tell you that we still continue to see that 95% of all the patients that are hospitalized here at Quia with COVID, and almost 100% of those that die of COVID are unvaccinated. It's rare that we see a fully vaccinated person pass away. We have had a few. They tend to be very elderly, in their late 80s to 90s, and generally with more than one of those underlying chronic conditions. So, can we get a booster of our 3rd shot at the Tulare event? That's a great question. I will find out, and we'll. I say, Maria, is that yes, or that's the case, or?
Shots, yes.
Oh, we can.
Yes.
Okay, so the answer is yes. Bring your vaccination card to show that you've had the 2 shots already, or the 1 shot of Johnson & Johnson, and I think we will have all 3 flavors out there: Pfizer, Moderna, and Johnson & Johnson.
Make an appointment.
Oh, yes. So go on to, you still have to have an appointment, and getting on the My Turn application, so you can log on to the quiahealth.org website, and you'll see the link to the My Turn. Very easy to make an appointment there. Or you can go on to the state's My Turn, but I would really suggest going on to the quiahealth.org website. So thank you, Maria. The last thing, Deborah said, if I had time, if I would maybe just brief all of you on some of the things that we've been doing over the last couple weeks, reaching out to various stakeholder groups throughout our community to brief them on our master facility planning efforts over these last couple years. Even though COVID has pretty much felt like it's consumed every waking moment of our professional lives, we have continued to do a lot of planning around the development of a new hospital wing on our downtown campus, just immediately adjacent and west of the Sequoia wing. We've been studying actually a couple options. One option is to build 2 shorter towers, a 5-story and a 4-story tower that would really be done in phases. It would start in roughly January of 2026 and would be finally finished January 1 of 2040. So it would span a pretty good amount of time, but that's to allow us to do it in phases, allows Quia to rebuild cash reserves and borrowing capacity between the 2 phases. But when it was all said and done, it would give us 240 brand new, beautiful, large patient rooms, even larger than the rooms in the Sequoia wing, and twice the size of the rooms in the Mineral King wing. So if you've ever been a patient in the Mineral King wing, you know what I'm talking about. It's very tiny, pie-shaped rooms, the bed's up against the wall, and it's pretty crammed when you look at the technology, the IV pumps, the monitors, and then the doctors and nurses and maybe a family member. It's pretty tight-packed, but this literally would allow the bed, you can walk around the bed, plenty of room for equipment and staff and family members. So really an exciting modernization of Quia Health and continuing to expand to meet our community's needs. The other option is a 9-story tower. Still would be built on the same timetable, done in phases, building out the first 5 floors initially, and then the last 4 floors down the road. But the cost is about $135 million less with that approach, because you're only building one tower and you're building it in today's dollars rather than building that second tower down the road where the cost of construction is inflated over the time. So there are definitely pros and cons to both, and that's essentially these. We have 16 different stakeholder groups that we've kind of put together, and they represent all different factions of our community. Yesterday, I presented to a group of realtors. The night before, a group of Latino ambassadors. The day before that, the Quia Health Foundation Board. So I think I've done 9 presentations so far, and I have 9 more to go. They go from anywhere from an hour and a half to 2 hours, but I kind of give them a very brief but comprehensive and pretty succinct overview of who Quia Health is. Because that's definitely one of the things that we learned from Measure H, is that for whatever reason, we were a pretty well-kept secret in many respects in terms of the breadth and depth of the services we provide, the affiliations and partnerships we have with like the Cleveland Clinic and USC Neurosciences, Keck School of Medicine, Valley Children's. A lot of folks just aren't aware of that. A lot of folks thought we were owned by a corporate entity that wasn't located here locally. They thought we were a for-profit hospital that was owned by shareholders, and so there's a lot of misunderstanding out there. So, I could, me, I could talk for hours about who we are and what we do and why we exist, and but I try to give them just in about 15 or 20 minutes, kind of this pretty comprehensive overview of who we are. I then shift into the master facility planning that we have been doing really since 1999. Remember, we had the major earthquake in Northridge in 1994. A couple years later, the state legislature passed Senate Bill 1953, which required all California hospitals to meet certain seismic building codes over different points in time. January 1st, 2030, the current law does not allow us to use any of the beds in the Mineral King Wing for acute inpatient care, and there's 206 of the 435 beds that we have downtown are in that Mineral King Wing. So I talk about that and kind of bring them up to present time, and then I array those 2 options that I just shared with you, and give them kind of the timetable, a visual look at it, an aerial view, a 3D view, and then I ask for a show of hands. In that short period of time that you had to digest this, which option do you prefer? So getting a lot of great reaction, great feedback, perspective, and literally asking them for advice as well, because there are about 68,000 voters that live within the Quia Delta Healthcare District. And at some point, we will need to go to those voters and ask them to support a general obligation bond, perhaps 2. If we break them up into phases, then we could do 2 smaller ones over time. And we cannot do either of these options without support from the community. We definitely will fund as much as we possibly can by using our cash reserves, our own borrowing capacity from issuing revenue bonds, our bank financing. We'll conduct a community campaign to fundraise. We'll look for grants, but we will never be able to raise enough to be able to provide these new modern facilities to our community. So I got to get the word out to 68,000 people. and hopefully they, after hearing what our plans are, and they get excited about it. And obviously the bonds have to be affordable, but it is really an investment that stays here locally. Every single penny of that general obligation bond you will see. You will see it, so stay here, right here on our downtown campus. It will not go, nationwide or statewide. It's one of the few taxes that actually stays right here in our community. So I'm asking these stakeholders, how should I best message? How should I best inform folks? And we have a very diverse population here that cuts across multiple races and ethnicity, gender, age, and generational. And folks, they receive information different ways, or how they like to receive information, and what's most important to them. Because I think the question is, if I support this, this project and bond measure, what does it do for me? And so the first thing it does is it helps us recruit and retain outstanding physicians and nurses and other clinical staff. Doctors and nurses, they want to work in modern facilities. They want to work with modern technology. And we, despite living in a fairly small community, we have very modern facilities, very leading edge technology, and we have some outstanding physicians. When you think about our neurosurgeons are literally the faculty at the USC Keck School of Medicine Neurosciences Institute. Those are the neurosurgeons that are taking care of us and treating major head traumas and spine surgery, and they wouldn't come here if we could not provide them state-of-the-art operating rooms and facilities and technology to allow them to do their work at the level that they want to do. So that's first and foremost. I think that's really the benefit to our community is just to be able to have outstanding healthcare, high quality healthcare provided by outstanding providers and staff right here locally. So a lot more to come. Again, a lot of different stakeholder groups, obviously big property owners who end up paying the majority of the tax, those that are in the agricultural business or other large commercial property owners, talking to them, employees, physicians, community leaders, government staff at the city of Visalia and the county of Tulare. I'm talking to a lot of their leaders. So by the time we're all said and done over this last month, we will have gathered the viewpoints of several hundred people. So that will be really what will help the board ultimately make the decision which option we select and the timing and how we'll fund it. And then we will build our communication campaign around that to really then take it on the road and to a much broader community audience. So. All right, I managed to squeeze that in too. Deborah, you're going to be so proud of me when you hear this. I don't see any other questions coming across the chat line. So again, I just want to, oh yes, Maria's encouraging me to encourage you all to celebrate Halloween in a safe way. I'm not going to tell you not to gather. I absolutely want to see our kids out there trick-or-treating. We'll be opening our door to all the trick-or-treaters. I don't know if you've seen that one commercial, is it Baker Mansfield or Baker, the quarterback for the Cleveland Browns, when the kids come up to the porch and he brings out the nacho cheese and the chips and squirts it all into their bags like they're at a football game. I think that's a hilarious commercial. We here at Quia Health will all be dressing up in Disney theme costumes this next Friday. Fortunately, we won't have a telecast, so we won't be captured on live film. And then tomorrow is Breast Cancer Awareness Day, or what we call Pink Friday. So tomorrow, October 22nd, is the official day in October that we celebrate the fight against breast cancer and raise awareness about it. So a very special day of recognition in the healthcare industry. So with that, I think I'll wrap things up and just say thank you to everybody for joining us today. Thank you again for all your questions, and thank you for your support of Quia Health. It means the world to us. And so I wish you all a great day and a wonderful weekend. Take care.